Hi, my name is Janelle, a nurse with Park Nicollet. Your healthcare team, including your primary care doctor, pharmacist, nurse, educator, and other clinicians, along with this video, will teach you how to take care of your condition by learning how to safely take warfarin, an anticoagulation medicine. But it is essential to understand that you, like Bridget, are the most important person on your healthcare team. We provide you with the support you need, but you are the key to success. As part of this video, you'll see some of the challenges Bridget faces. She may have a different condition than you, or she may be a different age, gender, or race than you. But there is one thing you both have in common. Like you, she needed to learn the same skills to take warfarin safely. By watching this video, you'll learn two important things. First, why and how blood clots abnormally, and second, the skills you need to safely take warfarin. Let's join Bridget now and learn a little more about her story.
It was about 8 years ago, and I had a blood clot, a subclavian blood clot, and one in my arm, and ended up going to the emergency room. I was afraid because of the unknown. Understanding my condition was one of my first concerns when I learned I had to take this medication.
It is natural for blood to clot sometimes, for example when you skin your knee. Normally, blood cells, including platelets, flow through your blood vessels freely. These cells are important in the clotting process. The clotting helps minimize the loss of blood at the injury site. This is considered good clotting. However, some conditions can cause bad clotting. This is when blood gets stuck traveling through the bloodstream. Depending on the condition, the abnormal blood clot could occur in several locations in the body. Some of the most common places are in the heart or lungs. Other common locations include the legs and brain. Anticoagulation medicine may be recommended if you have deep vein thrombosis, or DVT, a heart valve replacement, atrial fibrillation, an irregular heartbeat, rheumatic heart disease, phlebitis, or swollen vein with clot, or had major surgery, including an orthopedic procedure, and ischemic stroke. All of these conditions are serious and can result in disability or even death. That is why your doctor has prescribed warfarin, sometimes referred to by its brand name of Coumadin. It is the most commonly prescribed anticoagulant medicine. Since you are the key member of your healthcare team, you need to learn skills to take warfarin safely. It is important to learn these skills because if you take too little warfarin, clots may form or get bigger. If you take too much warfarin, your blood may not clot quickly enough, which may increase your bleeding risk. The skills you need to learn include monitoring your warfarin dosages, communicating important medical information to your healthcare team, understanding what affects warfarin dosing, identifying bleeding or clotting problems, and knowing when and how to get help. Your healthcare team will help you understand how much warfarin you need to take.
In the beginning, you would go every day, and then eventually they would kind of wean you off of that. Coming every day, you go every other day or every third or fourth day.
Your initial and ongoing dosages are based on a blood test called an INR, or International Normalized Ratio. This test is vital to the success of your treatment because it measures how quickly or slowly your blood clots. The questionnaire you will be asked to complete at each INR test will help identify any lifestyle changes that could affect your INR level. It's important to have an INR test as often as your clinician recommends. Initially, you may need to have an INR test daily or every few days. As your INR level stabilizes, you will not need to have INR tests as often. Make sure your clinician has given you a lab order for an INR test. Have your blood drawn for your INR at your clinic lab in the morning. This will help you get your results and new warfarin dose the same day. Your clinician may change your warfarin doses based on your INR results. We may also need to change the strength of your pill or your weekly dosing schedule to more safely manage your warfarin therapy. So follow your clinician's instructions exactly. If you don't get your test result the same day, continue taking your warfarin as prescribed and call your clinic the next day for further instructions. It is important to take your warfarin at the same time every day to avoid missing a dose, preferably in the evening. The following guidelines will help you keep on track. Record each dose on your calendar. If you miss a dose, take it as soon as you remember if it is the same day. If you miss a dose for 1 or more days, call your clinician right away. Record the date of the missed dose on your calendar. If you take the wrong dose or are unsure if you took a dose, call your clinician. There are also a few things you should remember not to do. Do not take more or less of the medicine than prescribed. Do not take the medicine more often than prescribed. And do not stop taking the medicine unless your clinician has told you to. Another critical skill is knowing what and when you need to communicate with your healthcare team. Some changes to your everyday routine may not seem important but can seriously affect your health. Before starting warfarin, you need to inform your clinician of all other medicines you are taking. Other medicines can affect your INR test and how much warfarin you need. Once you've started warfarin, call your clinician before taking any new medicines or when stopping them. This includes prescription drugs, including antibiotics, over-the-counter medicines, vitamins or nutritional supplements such as Ensure or Viactive, and herbal supplements.
Can I take Tylenol? Can I take vitamins? Can I take over-the-counter medications? All of these things can interact with the warfarin, so it's important to let your care team know if you're making any changes.
It is important to tell your healthcare team about certain lifestyle changes. These include fever, nausea, vomiting, or diarrhea lasting longer than 24 hours, changes in your diet or exercise routine, any future medical, surgical, or dental procedures you need to have, any travel plans if it will affect your INR testing, and if you are pregnant or planning to become pregnant. While taking warfarin, you should be using birth control since warfarin can cause birth defects to the developing fetus. If you are planning to become pregnant, be sure to talk with your doctor about alternative medicines.
They never made me feel as if I was asking too many questions or calling too many times to say, what about this? Or I've noticed that I have a bruise and it's getting bigger. Should I be concerned with this? Or they just always made me feel like it was important and it was better to call them and ask them questions. Better to be safe than sorry.
If you have a major accident or other emergency and are unable to communicate to a medical professional, it is important they know you are taking an anticoagulant medicine. Be sure to wear a medical alert bracelet or carry a card in your wallet indicating you are taking warfarin. Some lifestyle habits affect warfarin, which is another reason why regular INR testing is so important.
From the get-go, it was really important to be honest with them. They didn't want you to change your diets. They wanted you to continue eating the same foods that you ate so that they could dose you properly.
The key is to minimize effects by maintaining consistent lifestyle habits. Be consistent on a weekly basis with foods high in vitamin K, since it can change the way warfarin works in your body. Foods common in vitamin K include green vegetables such as asparagus, broccoli, Brussels sprouts, cabbage, and celery, dark leafy vegetables such as beets, mustard and turnip greens, collards, kale, and spinach, salad greens such as endive and lettuce, for example, Bibb, butterhead, romaine, and green leaf. Legumes such as peas and various beans, for example, green, snap, and string. Tell your clinician if your diet changes. For example, you eat more or less of foods rich in vitamin K, if you decide to go on a special diet or lose or gain weight, if you are not eating because of an illness. If you drink green tea, be consistent. Ideally, do not drink any alcohol. If you do drink alcohol, for your safety, drink no more than 5 alcoholic drinks a week, or 2 drinks maximum on any given day, unless your doctor instructs you differently. Be honest with your clinician about your alcohol intake. Avoid activities that put you at risk of bruising, cuts, or serious injury, since the risk of bleeding is higher while on warfarin. Also, if you shave, use an electric shaver rather than a straight edge razor. It is important to get immediate emergency care for serious bleeding and clotting. You should call 911 or go to the nearest emergency center for a serious fall or injury to the head, vomiting red blood or material that looks like coffee grounds, bowel movements that are black or contain blood, urine that is dark brown or contains blood, severe ongoing headaches, coughing up blood, dizziness or visual or speech problems, weakness, numbness, or tingling in your limbs, new shortness of breath or other breathing problems, nosebleeds, if frequent or heavy, and do not stop within 10 or 15 minutes. You should call your doctor if you notice frequent bruises or bruises that continue to get bigger, swelling that feels tender for no reason, especially in your legs, bleeding heavily from your gums after brushing your teeth, prolonged bleeding from small cuts, heavy or prolonged menstrual periods.
They always want you to call if you notice any changes, bleeding, bruising, just any shortness of breath, anything that is alarming to you or that you notice is not normal for you.
Warfarin has been prescribed by your doctor to help prevent potentially serious abnormal clotting. Along with your doctor, my colleagues and I at Park Nicollet are here to help you stabilize your INR level. As partners with you in your anticoagulation therapy, we assist in managing your medical care and provide support to help you learn and master the skills presented in this video. By learning and mastering these skills, you can better manage your condition.